Welcome to PSE Uncut. I'm Carolyn Grimes, and joining me today is Dr. Dan Maman and Dr. Shaun Parson. President Obama has been in office for 8 years, and he's definitely aged. As a plastic surgeon, what would you do to rejuvenate him?
You know, I mean, in fairness, Dan, who looks better after 8 years of being beaten up? I mean, he looks like anybody's going to look 8 years later in their life.
Look, I totally agree. I mean, you know, you would say he's the most powerful person in the world.
You may say that. I don't know if I say that.
Well, he's certainly got one of the most fatiguing jobs that one could imagine. And we know that fatigue, stress, overwork can expedite the signs of aging.
Just like anybody else, I mean, looking at the picture, he's starting to lose facial volume. I mean, you're seeing it in his temples. You're starting to see fine wrinkles around the eyes. He could use volume. He could use maybe not even surgery, maybe just doing some non-surgical things around his eyes just to kind of refresh things.
I mean, when we look at the sort of the before and after photos, they seem dramatic because they're side by side, but they're actually very characteristic, very typical of someone who's aged from early 40s to sort of early to mid 50s. When I look at this picture, I think the most telltale signs that I see of aging are sort of the deepening of the furrows of the forehead and the overall appearance of the periorbital region. He certainly has some deepening of the bag, some lengthening in the crow's feet, a little bit of ptosis of the brow. So I think some non-invasive, perhaps Botox of the forehead and crow's feet, and if he wanted, some surgical intervention around the eyes.